Hey guys, what's going on? Juan here with Better Body Medical Massage. I'm over here located in St. Petersburg, and I'm here to talk to Rob, Dr.
Howdy.
Rob, on dry needling. Is it real or is it a fluke? We'll find out in a bit. Dr. Rob, please tell us more about who you are and what you do.
Okay, so I am a doctor of physical therapy. I'm not an actual doctor, but I use the title Dr. Rob because it's good for marketing. So I guess I could say that I'm honest. I'm an honest guy. But I run a cash pay concierge physical therapy practice here in St. Petersburg. I do virtual care. I do mobile care, which can be in-home and gym. I don't have a brick and mortar. So I kind of like meeting my patients, my clients, wherever they are in the world.
I'm curious to know, do medical doctors not see you guys as doctors?
No, they don't.
No, okay.
No. And I like that they don't.
Okay.
I like not being an actual doctor. I mean, technically I'm a doctor, but like in the medical context, doctor, like if you're in a hospital and you call me doctor, they'd be like, oh, you can prescribe medications and write all these different things.
Right.
I didn't want that level of responsibility, so I didn't go for that.
I mean, the pay shows it too, apparently, right?
Yeah.
Okay, cool. But you don't take any offense whatsoever on it?
What?
When you're like, oh, you're not a real doctor, and you're like, yeah.
I'd be the first to say that. I'd be like, they'll be like, oh, doctor, and I'd be like, not a doctor.
I'm not a real doctor.
Technically, I'm a doctor. Like I'm a doctor in the same way that Indiana Jones is, right? Like I'm not. He's not gonna fix your spleen. He's not gonna write antibiotic prescription for you. Neither am I.
Okay, I was just curious to know because you came off shooting guns saying I'm not a real doctor. I'm like, it sounds like it's very common.
There's just some physical therapists and like other healthcare practitioners that like really kind of lean into that, and I don't know if that does a service to our clients or our patients for them to think that we are. I've had people come to me and they're like, hey, you're a doctor, right? And I'm like, eh. And they're like, can you write a prescription for pain medications? And I'm like, no, that's not.
Wait, can you? Can physical therapists not do that? Oh, interesting. Okay,
No.
I didn't know. I felt like if it was through like some kind of insurance-based type of practice, they could.
No.
No, okay. Well, that's something I didn't know. So
There you go. Learn something new every day.
But the real reason why I brought you on here is for dry needling.
Yep.
So for the people who don't know what dry needling is, can you please elaborate a little bit more on it?
Yes. So dry needling is it's a manual therapy type intervention where essentially what we do is we use acupuncture needles to directly address trigger points, or other areas of kind of focal pain in muscles.
Okay, and so what exactly is a trigger point? Just to educate our viewers out there, because there could be people out there that are like on the verge of getting surgery, and it could be something as small as getting rid of trigger points to ease off the discomfort that they're living with.
Yeah. So trigger points are, they're typically described as like a focal area of chronically contracted muscle, right? So like a little nodule or like just a really dense kind of painful area. In the literature, they describe it as like a palpable taut band in the muscle that elicits that, and when you palpate it, it either elicits like a twitch, and it's usually painful. So that's kind of what it is. The research on this stuff is always. It always tends to make it kind of obnoxious to to talk about it because the research isn't real consistent with like what it is. If you can consistently find them, if they have the kind of physical, mechanical properties that we tend to think they do, it's always just like it's such a like case by case sort of thing.
Okay, and so how does dry needling come into the picture with trigger points? They go hand in hand, or
they can.
Okay.
So and like that's another one of the things is that like with dry needling, again the research is kind of obnoxious because it's not. Like some people sell it as like the most magical and crazy thing and the most effective thing you could possibly do.
Right.
But again, it's another tool in the toolbox, right? So like you can address a trigger point, right? I'm sure you do that all the time, right?
Right.
And dry needling it's just another way of doing that, with a different kind of like mental aspect. Getting a needle is a kind of like a high investment sort of thing for a lot of people. What was your question?
How does dry needling and trigger points go hand in hand? Like, do you target them specifically while you're doing dry needling?
Yeah.
Or I know you said earlier that whatever area that feels painful or has a form of discomfort in it, you just pop a needle in there. Is it that broad of a technique?
It can be.
Oh, shoot, okay.
Yeah. So that's kind of what I like about dry needling is that it can be so specific. And that's also kind of why I don't, right? Like why I think massage is such a good thing is because like you can go right in for the target.
That's correct.
But it's also like the therapeutic touch component isn't necessarily there as much with the dry needling. So like what you do is very, very different and very, very powerful, and it's a great way of addressing trigger points. With dry needling, it's more direct. Some people respond really, really, really well to it. Some people don't respond at all. But again, it's just you find this painful area in the muscle, and then kind of what it does is it changes the way that the nervous system is interacting with that painful area that you find. Okay.
I think I saw you last night at a networking event that you were demonstrating how dry needles are used, and so from what I remember seeing, there was electrical stimulation going through that needle. Yeah. But what you were doing, you weren't necessarily using electricity or you weren't using electricity to stimulate the muscle or in any shape or form, which kind of looked a lot more like acupuncture. Yep. It's very similar to that or nowhere near what it does. It's what acupuncture does.
Yeah. So there are similarities, and we had talked about this before, and I missed one kind of important similarity, which is so obviously we use the same tools, right? So the needles are the same. I buy my needles from an acupuncture online store. Okay. Real good stuff. I like it. The other similarity that we have is in acupuncture, there's a kind of school of approach called Ashur, which just means like right there, where the acupuncturist, and I don't know, I probably mispronounced that, and I'm probably going to, not do a good job of describing what this is. You guys can correct me if you're an acupuncturist. But Ashur is just basically where you're like digging around in the muscle and you find something painful. And in acupuncture, they call it an Ashur point. And then with Western medicine, we just call it a trigger point.
Oh, okay.
Yeah. So there's similarities, but with acupuncture, they kind of work as like a holistic medical health system, where they can treat visceral issues or disease conditions. With this, we're just going in for trying to manage pain and like other kind of specific musculoskeletal concerns.
Oh, that's right. Acupuncturists are considered doctors in their field as well, right? It's like doctor of acupuncture.
That's a good question though.
I think that might be true or wrong. I'm not too sure. I think I might have.
I don't know if. Yeah, I should know that. We should know that.
Yeah, we should.
Can they prescribe medications? That would be the question if they're like a Western doctor, if they're considered doctors in Western medicine, right? Because we have Western and Eastern medicine.
That is true. I think they would be prescribing more herbs of sorts.
Yeah, but then
I could be wrong though. Once again, we should know this though.
Yeah, well, yeah, because like a lot of the times when I was in Washington, in Seattle, they have like a big holistic kind of Eastern medicine school, Bastyr, where a lot of times the acupuncturists are also. They'll study Chinese herbal medicine. But then, I mean, my question would be like, okay, so if you have specialization in skill and qualifications there, does that mean you can come into a hospital and prescribe pills? I wouldn't think so.
I don't think so.
I think you have to be like a Western trained physician.
Guess who I'm bringing on board next?
Who?
An acupuncturist. There you go. So if you guys want to reach out to me and you're an acupuncturist, that'd be really cool. I want to interview you, ask you a lot of questions because I apparently have a lot of them.
Yeah.
But back on track here.
Good question.
Back on track here. Does dry needling work?
Yes.
What did the study show? Is there more of a positive result with using dry needling against physical therapy treatments? Or is there more positive results using dry needling versus those who don't use dry needling?
Yeah. I mean, again, the research, it all tends to kind of behave the same. It tends to tell the same story around most of these kinds of interventions, right? Which is where, so dry needling is as effective as just about anything else I'll do that's hands-on, right? So it's as effective as massage. It's as effective as, joint mobilizations or, spinal manipulations for treating, certain kinds of pain. But it's not I wish it was a magic bullet. And for some people it is, just like everything else, right? Some people, you know, you mobilize their joint and they have no trouble for the rest of their life.
Right.
You know? But for this, it's like, some people get the magic bullet and they're like, oh, holy cow, I don't have pain in my back anymore. And that's the first time it's been like that in years.
And they call you Jesus right now.
They call you Jesus, yeah. And then you never see them again because they're cured.
Yep.
But then, you know, you're going to get people where they hate it and they freak out. Usually that's going to be people that you shouldn't have needled anyway, because if somebody's afraid of needles, it's a good reason not to needle them. I would never push that on them.
It is definitely an invasive treatment for sure.
Yeah.
I mean, you got needles going right into your body.
Yeah.
The physical therapist that I saw that was dry needling, there would be some kind of blood that would come out of their holes right afterwards.
Huh?
So, yeah, after being poked, there'd be some kind of blood. And now, like I think, in cases like that, it just depends on the person as well, because you got people who just bleed very easily.
Yeah. And you know, if somebody does have a bleeding condition, usually I won't needle them, just because again, like it's invasive, and I don't want there to be any possibility for there to be an infection. And as it is, even if somebody does have a bleeding condition or something like that, odds are super, super low. You know, I'm gloved up. We'll sterilize the area if that is kind of a thing that we're concerned about. But even in that situation, it's unlikely they'll get infected, but like, why take a risk, you know? But shoot, where was I going with that?
Oh, I actually had a question that stemmed off that what you were saying, is there a group of people that shouldn't try dry needling?
Yeah, you know, I think mostly it's people that have like a serious dry needling phobia, or needling phobia. Like if you're really terrified of needles, it's not going to be great for you, because the idea is to calm down the nervous system with the needling. And if you're already coming into it like ready to freak out, we just won't do it. You know, people that have a history of cancer, sometimes that's a thing that you want to be concerned about. You know, again, bleeding disorders. There's a couple other contraindications. But for the most part, it's really safe.
Okay.
Yeah.
Okay. That's really what I wanted to know, if it was okay for everyone to use. But apparently, it really just depends on the individual if they have something against needles or not.
Yeah.
But I'm talking more of like health risks. Like people who,
like who would I never needle?
Yeah.
I would never needle. I wouldn't needle a woman that was pregnant.
Okay.
Like especially in like if we're in like the first trimester. Honestly, I think I wouldn't needle a pregnant woman. Period. Just because it's like the odds again are super, super low that there will be some sort of complication. But that's one of those things where if there is a complication, you know, somehow induced by the needling, it's really not, like, the juice ain't worth the squeeze. You know, why run the risk when there's other things like a massage or, you know, scraping or anything else that again, according to the research, are going to be just as effective. You know.
Okay, well, thanks for answering that.
Yeah.
Honestly, you kind of answered a lot of my questions that I already had during your whole spiel. What you were saying. I kind of have no more questions to ask you, to be honest with you. So, if there's anything else you want the viewers to know about what you do, where you do it, or anything else you feel strongly about, please share it with me.
Yeah. So, it's interesting that you said you had that person. What was the bleeding? That was somebody that was, you were needled and you bled, or they were needled?
They were bleeding, so they were needled and there was just a bit of bleeding that came out. Okay. Now, so I kind of expected, all right, that it always happens, like there's always blood coming out.
Yeah, no, real rare. And you know, again, it's like, you can buy needles of various gauges, right? Like I have some needles that are like really beefy. Most of the ones that I use are real thin. You know, they're really thin. They're designed in a way to kind of slip right through the tissue where you almost don't feel it. You know, like there's the technique that I use, you almost never feel it. I mean, you can stick, last night at the networking thing, I put a needle right there in someone's masseter in their face, and she barely even felt it. You know, I was tapping on her jawbone, and she was like, "Oh, I can barely feel it at all." You know, so if you've never been needled before, okay. If you're terrified of needles, okay, but if you're curious about it, it can be really, really helpful. It can be really helpful. I'm not going to guarantee that. And it's also the thing about dry needling is that it's for me as a physical therapist. Again, it's a tool in the toolbox, but it's considered like a passive intervention, right? So passive interventions can be great for, you know, reducing pain, reducing sensitivity, for kind of helping somebody relearn their body. But at the end of the day, if somebody has an injury and they're trying to recover from it, that's really the way you're gonna recover is through work, or, you know. So that's why, you know, we could start off with needling, but there's always going to be exercises, there's always going to be education, there's always going to be ways to kind of rebuild and reinforce the body that you're not going to get from needling.
Hey man, it sounds like you've definitely been around the block a couple of years.
Yeah, it's been a minute.
Well, hey, Dr. Rob, appreciate you coming through and educating us on dry needling.
Yeah, my pleasure.
I had a lot of questions and you answered all of them, man.
Good.
Now, can you please tell the viewers where they can find you?
Yeah, you can find me on Instagram at Dr. Rob Jensen, DrRobJensen, or at my website, www.paragonppt.com.
Thanks, man. Thank you so much, guys. Thanks for tuning in. Till the next video.